Welcome back to Living Local. For families who have children with chronic medical conditions, the financial burden can be extreme. Because of high insurance premiums and copays, it can be a significant struggle to get their child the medical care that they need to stay alive. One local nonprofit is working to help these families. Joining us in studio is Dr. Dorian Mogg with RoEll Inc. Thank you so much for being here.
Thank you for having me here today.
So first of all, what does RoEll stand for, and what's the story behind how this nonprofit got started?
So RoEll is named after my two children, Robbie and Ellie, who were diagnosed with a chronic illness with type 1 diabetes when they were young. And helping people is something I've always been passionate about, and the accessibility to affordable health care is something I've always been aware of, but not sure what I could do to help that problem. When I went back to school to get my PhD, I took a class in nonprofit organizations and decided to make that my cognate. And in one of those classes, we had to develop a nonprofit about something we were passionate about. And so mine was on helping people access affordable health care. Fast forward a couple years later, and my husband and I were watching the nightly news, and there was a story on about EpiPens and how that was a burden for some families and the cost of that. And I just remember looking at him saying, I really want to start this nonprofit, and he just said, well, go for it. And so that was just kind of the push I needed to start. And as a parent of a child with chronic illness, I couldn't imagine going to the pharmacy and not being able to pay for the medicine that keeps them alive, or be able to figure out how I'm taking them to their specialty appointments, you know, 3 times or 4 times a year. So we wanted to do something to provide families with some temporary hope and help that were in those situations.
Wow, Dorian. Now, what exactly is the mission of RoEll?
So the mission is to provide families and young adults up to the age of 30 with either temporary or long-term support with prescription costs, medical equipment, medical care. We believe that no one should have to worry about how they're going to pay for their medicine or medical equipment in lieu of other basic life necessities, like paying for their house payment or rent or groceries. But that is something that so many people do have to encounter in not only, you know, the world, but in our neighborhoods and in our local areas.
I think it's so important to bring awareness to this topic. I think for the majority of folks out there, we don't need to take a medicine or go to a specialty doctor in order to stay alive. And that is a very real reality for so many people out there. I mean, so I think that bringing awareness is key to that, just to garner this empathy and showcase that there is a need there, and then to follow that up with action, which is exactly what you're doing. Who exactly do you help with RoEll?
We have helped a variety of families and young adults in different situations. So we started out just helping children up to the age of 18, and last fall decided to increase our age range up to the age of 30 to kind of help fill that gap and help those young adults who were aging off their parents' insurance, who were struggling to get affordable insurance of their own, or with the high copays and high premiums. We all remember the news stories of young adults who couldn't afford their insulin and were rationing their insulin and then dying, and because they didn't know where to turn for help. And we have helped several young adults in those types of situations. We've helped families with cost of prescriptions, with hospital bills, with providing financial support for medical equipment, and just different seasons of their life. Maybe they lost a job, they moved, they're in between jobs, they're going through different life circumstances like divorce, or have had life emergencies that last month their copays weren't a burden, but this month they are. You know, people with high deductibles in the first quarter of the month, that $1,000 when you go pick up your prescriptions is a burden. So we've helped a lot of families, you know, in the beginning of the year who have high deductible plans. We help from needs like insulin to needs for mental illness to patients who need prescriptions to help keep them safe. So we help in a wide range of situations.
What sort of feedback have you gotten from the families that you've helped?
That's the most rewarding part, is just, you know, a lot of these families didn't know we were a resource and didn't know where else to turn to. So just hearing their gratitude and how thankful they are, and that we were able to provide a little bit of hope and ease a little bit of worry and stress for them is really rewarding and keeps us wanting to continue to help more.
Dorian, how can our community support the work that RoEll is doing?
First of all, share our information. A lot of people don't know that we're here to help. So if you or someone you know is struggling with the cost of medicine or medical equipment or medical care, reach out to us. It's a really easy process. We don't ask for any paperwork for income or insurance. There's 5 questions. It's a quick turnaround. And if you are a medical provider or social worker or school nurse and you know someone who's struggling, reach out to us. You can visit our webpage or send us an email. If you like to donate to nonprofits, we are a 501c3. All of our funding goes directly back towards helping families and towards outreach. We don't have any overhead cost. So we are funded through grants, private donations through individuals and local organizations, and fundraising events. So if at the end of the year, Giving Tuesday's coming up, if you do donate to a nonprofit, think of us. You can reach us on Facebook or on our webpage and look for information on where to donate there as well.
Dorian, thank you so much for what you're doing to help families here in the Quad Cities.
Thank you.
We so appreciate your time today.
Thank you. Thanks for having me here.
If you would like some more information, you can visit RoEllinc.com. We'll also have those details posted on ourquadcities.com.